Integrated Joint Board meeting of 21st of April. So just before we start today's meeting, I've been asked to read out a short statement for members, given that this meeting falls within the pre-election period. So as members are aware, we're currently in the pre-election period in light of the forthcoming Scottish Parliament elections on the 6th of May. You've all received a copy of Angus Council's pre-election guidance. Section 5 of the guidance covers publicity, which includes online council or committee meetings, which are webcast or subsequently published by the council. We need as members to be aware of the legal requirement not to publish anything which appears to be designed to affect political support for a political party. The legislation makes it clear that the timing and circumstances of publicity is a key factor in deciding if it is politically partial, which is why there is greater sensitivity during the pre-election period. The key test is whether a particular act can be perceived as seeking to influence public opinion or to promote the public image of a particular candidate or group of candidates, whether or not they are existing members. A common sense approach is required, and I would remind members simply to be mindful of this in their discussion and debate today. Okay, and as our meeting's being held remotely, if you wish to ask a question or come in at any point, if you just want to raise your hand, either virtually or actually, and Karen will, I'm sure, assist in checking that I've come to everybody. I'd also just like to say at this point that while thankfully, COVID numbers are falling, it's clear there remains a huge effort and challenge for HSCP staff, the third sector partners and the private care home sector. And we support and commend all for their dedication in delivering health and social care services, including the continuing large-scale vaccination programme through continuing challenging circumstances. As an IJB, one of our biggest strengths is working collaboratively across all sectors, and this continues to be of huge importance as we move through remobilisation. And thank you to everybody for the papers that have been provided for us today. So moving to the agenda, agenda item 1 is apologies. Karen, have we got apologies?
Apologies today, Chair, from Ivan Cornford and Gary Malone and Dr. Emma Fletcher.
Okay, thank you. And item 2, declaration of interest. Do we have any declarations of interest? Councillor Bell, I see you've joined us. Welcome.
Yes, sorry about that. I had problems this morning for the IGB as well. Yeah, just my usual standing declaration of interest, which is a specific exclusion relating to being a non-executive director of Public Health Scotland that allows me to stay in and vote if required.
Okay, thank you. And do we have any other declarations of interest? No, not that I can see. Karen, do you see any? No. Okay, so moving on to agenda item 3, which is the minutes and action log. So we have here the minutes of 2 previous meetings, the 28th of October 2020 and the 24th of February 2021. And you'll have received these in your papers and had a chance to look over them. Are we happy to approve these minutes?
Yes.
Yeah, thank you. And moving on now to the sorry, just moving through my papers. Moving on now to the action log. So helpfully there's quite a lot of information being included in this action log, sort of explaining where we are with specific items. And I think this is especially true where the impact of COVID has perhaps affected timescales. Gail, do you have anything you want to add to the information contained in here?
Thank you, Chair. No, actually, I think I would just like to draw everybody's attention to the action points and the additional information that the Chair has guided you towards. We've deliberately put that in by way of information to update you all in the progress that we're taking with regard to the many action points. So no, I think they're, from my perspective, straightforward.
Does anybody have any questions or comments on this action log? Councillor Bell.
Thank you, Chair. I was just concerned about the slippage around the mental health strategy. Is there any sort of update since since this paper was produced?
The papers have been, I've alluded to the papers in the notes, Councillor Bell, particularly the communication document and the easy read. But if you're alluding to the financial framework that we've asked for information to come back to the IGB, no, there's been no update at this stage. The 3 IGBs in Tayside are still waiting on the plans and the financial framework. I can confirm this morning that NHS Tayside have still not appointed a director for mental health, but they are looking at putting in a support plan and a support team to work with the team, and that process is underway now.
Okay, thanks for that, Gail. Do we have any other questions or comments on the log? Are members happy to note this then? Moving on now to the final set of minutes here, which is the minutes of the Audit Committee on the 9th of December last year. And these minutes are for noting. So are members happy to note these minutes? Yep. Okay, thank you. And move on to item 4, which is appointments, and you have information contained within the agenda there about the appointment of the new NHS non-exec member Peter Davidson, who will be joining Angus IJB following the NHS board meeting at the end of April. And we look forward to welcoming Peter to the IJB, and also to note that Graham Martin will remain as a proxy member, as well as Donald McPherson. Okay, moving on to agenda item number 5, and this is the Living Life Well Tayside Mental Health and Wellbeing Strategy. So we have links to the now published Living Life Well strategy within this paper, and also an update on local implementation with regard to the 7-day working. So we're being asked, there's a number of recommendations in here, including noting the publication and the change of the title of the strategy, to acknowledge the joint working between the 3 health and social care partnerships. Note, as has been mentioned already, that the financial framework remains outstanding, and request that the Chief Finance Officer to bring an update to future IGB once work is complete. Note the commencement of 7-day working, and acknowledge the development of local implementation plan, and again request a progress update back to the IJB. So I'm not sure, Gail, who's speaking to this paper.
I'll start it off, Chair. Thank you for reading the recommendations there, but the current position is, as we've said, we've put in the links for everybody, because I don't know if you've all had sight on the Living Life Well strategy or the communication and engagement report that Councillor Speed particularly asked for at a previous meeting. There's also an easy read version now that I would like to draw your attention to as well. We've also said about the financial framework, I forgot that had been put in the report. So I think I would just like to bring in Jill Galloway now to give you an update on the 7-day working. That work, Jill's taken over supporting the mental health team while we're re-looking at the portfolios of the heads of service. Jill, can you give an update?
Yeah, Gail, thank you, Chair. So just to give a bit of an update, we had planned commencement of the 7-day service within Angus on Monday the 19th, and I can confirm that that started. So this weekend will be the first weekend in Angus where we've got the 7-day service around that. The service is due to be functional between 9 and 5 over the weekends, and we've built in some review periods so that we can review the demand and the capacity of the team working over the weekend. But we do anticipate that the coverage from 9 to 5 will be suffice in terms of the demand, and we're working alongside colleagues within Carsview to support the out with the 9 to 5 hours as is in place currently. Other than that, Chair, I don't think there's anything else to note, apart from thanks to the staff and the work that was progressed to get this commenced on the date that we had anticipated.
Chair, I can also confirm that Dr. David Strang is coming back to NHS Tayside. He has already started his conversations. An updated report from the Chief Executive and the Chief Executives of the local authorities has been submitted to Dr. Strang, and I have got my interview with him next week. He's interviewing a number of people.
That's great. Thanks very much to Gail and to Jill, and really good to see that the 7-day working commencing. Just before I open it up to questions, just on there's two obviously recommendations regarding bringing updates back to the IJB. One on the financial position, which I know we're waiting from information from NHS Tayside. But in terms of the local implementation plan, do we have any idea of when we might see an update on that? Because, you know, obviously that'll be of particular interest to us.
Yeah, Chair, I'm happy to respond to that in terms of the local implementation plan. So that's something that we're working very closely with the programme team for mental health around, and obviously from a local perspective, we're going to be pulling together a small group to look at what we actually have to implement within Angus, because there is going to be the overarching ones, and then we will have some specific actions that we'll need to look to implement that are specifically around the needs of Angus in relation to the Living Life Well strategic plan. So I think realistically we're probably looking at the August IJB for a full implementation plan coming back, where we can give assurance that relevant and appropriate level of comms and engagement have obviously also taken place as part of the development of that plan. And we would be keen to hear the output of Dr. Strang coming back in April as well, to ensure that we do include any updates from that within our local implementation plan.
That's great. Thanks very much for that. Questions and comments? Okay, I've got Peter.
Yeah, thanks, Chair. Just some anecdotal information that I got this morning from other IJB reps on Tayside. One is that the cast view option was A, the only option that was offered, and B, was the least preferred by anybody who was consulted, any user who was consulted. So it would appear that a number of users are not happy with the cast view choice. But that's anecdotal. The second thing is that apparently some sort of interim hub was opened in Perth, and it has been swamped by people. So I don't know what the level of demand is anticipated for our local hub, but I think we need to be prepared for it to be very, very, very busy. And I'm not sure if 9 to 5 will cope with the number of people who require services.
Okay, thanks for that, Peter. I'm not sure who would like to respond to some of those issues.
Jill's got her hand up, Chair, so I can add in after that.
Thanks, Chair. Thanks, Gail. So in terms of the coverage, Peter, I think we're starting at 9 to 5 at the moment, and we'll review that on a weekly and a fortnightly basis to look at the actual activity that comes through, because there is also the option that this reduces workload through the week for people as well. So we need to make sure that our workforce across the whole 7 days is relevant and meets the demand of the population. So please be assured that we will be reviewing that on a regular basis as we kind of kick off the rollout of the 7-day programme, and we'll be looking at it by locality as well.
Thanks, Jill. I've got Alison.
I just want to thank you, Chair. I just wanted to highlight that as the host for primary care, Angus has a responsibility across the whole of the Tayside, and we've got some quite exciting opportunities around the Living Life Well and the development of models within primary care, and some funding that is coming out from the Scottish Government. Also would like to highlight some of the work on prescribing. So a future report, yes, might cover some of our services, but also we need to be thinking strategically around primary care. And there's a primary and community care work stream, which will be looking at the models of care within general practice for mental health and wellbeing. and also community mental health teams. And we've got some work in progress up in the Links Health Centre that will inform that, which is, you know, I find that quite exciting. So lots of opportunity. And the financial framework is relevant because it helps enable us to get the funding into the right place to support some of the new GP leadership roles. So I would emphasise that that is very important. We're trying not to let any of that hold us back, but with additional resources there, we could really focus efforts on spreading what works, because we've had a lot of success, but making sure that's consistent across Angus. But certainly also for general practice, our responsibility is around supporting across Tayside.
That's great. Thanks very much for that. I think that's really helpful and exciting to hear there are some really good opportunities as well. Councillor Speed.
Yeah, I welcome the 7-day working, but also echo Peter Burt's concerns around the kind of 9 to 5, and I guess some of the feedback that I've received that's similar in terms of concerns around Carse View. However, I know Gillian Galloway's response to that, so we'll look out for further information that comes as things progress. With regards to the Live Life Well document, I've raised this concern before, but I'm particularly concerned around the fact that there's no mention specifically of people with physical disabilities alongside kind of learning disability and autism, because not everybody with physical disability necessarily has a learning disability and or autism as well. Statistically, evidence suggests that mental health difficulties and depression are more common for people with a physical disability than the general population. And we know that they often experience the greatest barriers in terms of access to services, buildings, transport and housing. And often people with a physical disability experience communication difficulties and require either support or advocacy to be able to communicate their needs, whether that be digitally or telephone or face-to-face. So I'm just really looking for some assurances as to what can and will be done to address this.
Thanks for that, Councillor Speed. I don't know, Gail or George, if you want to respond to that. We obviously have the published strategy here, the published mental health strategy, but I don't know if you want to come in on some of Councillor Speed's concerns there.
I can't actually answer in relation to why that wasn't included, Councillor Speed. I don't actually have an answer there because we weren't party to that. As you know, we got the document at the same time as yourself, but it has been escalated and we can continue to escalate it. But not everybody, as you've said, with physical disability is a mental health condition either. So I suppose, I don't have the answer there, but I suppose they were trying to steer away from part of that, including all of the information they had. But I will raise it again, Councillor Speed. I will say that, but at the moment we don't have a mental health director. So the team is just being established who will be looking at that. Locally, in our implementation plan, I can ask Jill to take cognizance of that, and George as well within his service as well, when we're developing our own local implementation plan. George is looking to come in, Imogen.
George?
Thanks, Chair. Learning disability was included within the remit of the strategy. It doesn't have a high profile within the report, I think it would be fair to say. There's only a couple of pages, although there's another page about psychology services development, which is very applicable. However, myself and Arlene Mitchell from the Dundee Partnership co-chair the Learning Disability work stream. It hasn't really got off the ground yet. We're still in discussions about programme support and so on. And I think we would be looking at people with complex needs within that group. So some assurance to Lois in that regard there.
Yeah.
Thanks for that.
George.
Chair, sorry, I can confirm to Councillor Speed that George and I and Linda Kennedy have been in contact with Professor Mike Winter regarding some of these aspects. So just to assure you that we're doing what we can locally.
Okay, thank you. Yeah, certainly would welcome seeing a raised profile around learning disability and autism, as well as the inclusion of physical disabilities and complex care needs.
Okay, I did see Hayley's hand up before, but oh yes, she's there. Hayley, did you want to come in?
Yeah, thanks, Chair. It was really just to highlight, I suppose, third sector concerns. It's been highlighted in the past that there wasn't a full co-production in regards to the third sector organisations being involved in the writing of the strategy. And the concern now, as it's been published, is where will the engagement with the third sector be in regards to mental health and well-being, and how will then the third sector be able to support the strategy and help it obviously flourish and grow, because there wasn't a huge involvement at the beginning. So I know that there's a lot of different charities and organisations that are a bit concerned on the way forward. So just wanted to highlight that.
Yeah, thanks for that, Hayley. And I think in terms of this being a pan-Tayside strategy, I think certainly locally we would be able to, you know, in Angus, take forward some of that engagement with our third sector colleagues. As I said at the very start, collaboration across Angus is the key. What makes it work very well here. I don't know if Gail, do you want to come in and follow up on that?
Yes, I've actually got a note of that particular issue, Hayley, for my conversation with Dr. Strand, following a previous conversation I've had with Hayley regarding that, Chair.
Thank you. Thank you very much, Gail. That's really helpful.
George, did you want to come in? I see you waving. You're on mute.
Sorry, mute wouldn't come off. Yeah, just to say, Hayley, that I think we would, in any case, monitor the progress through the strategic planning group, and obviously third sector are well represented in that setting.
Got Dr. Humble.
Yeah, hi. Just for this third sector, like the GP subcommittee really just got this document once it'd been finalised. We usually got a final draft. We did notice, I think one of us did a Google search or a spell check search through it, and there was virtually no mention of primary care or general practice in it. And it does mention lots about improving the interfaces and getting systems working together. So hopefully that includes obviously the interface between mental health services and general practice. That's where a lot of the problems are at the moment. I mean, welcome the increase in services and the 7-day working. The difficulty is that the GP working day for practice is 8 till 6. So if services close at 5, the gap between 5 and 6 is always the problem. And obviously then you've got linking with out of hours service. 8 to 9 in the morning is not so much of a problem, but it's something we fed back. We've actually had our meeting with David Strang last week, so we have fed back as well. And basically it's something we raised at the start, because you do need to get a seamless interface. The only other option is you've got a single point of contact for the whole 24 hours, and it doesn't matter what time it is, because you tend to find a lot of the mental health crises happen between 5 and 6, and trying to get things sorted out is quite difficult once the mainstream services are closed. Obviously, when it's out of hours period, it's the same service the whole time. So it's great to see them working during the day at weekends as well. But obviously, that's really all going to be covered by the out of hours service anyway.
Okay, thanks for that. Dr. Henry, I see your hand up as well.
Hi, yes, so just for information for the IJB is that I've taken on a leadership role as the Associate Medical Director for Women, Children and Families, and that includes child and adolescent mental health. We're doing quite a lot of improvement work currently, and I think we also have received word from the government that there will be an increase in funding for child and adolescent mental health, recognising a lot of the stresses of the pandemic have fallen on our children and young people. So really we are, as well as sitting in the overarching mental health strategy from Living Life Well, there is some very specific work just about how we can actually see our young people, what they need, and trying to develop the services. I think reflecting that there are significant staffing challenges within our whole of mental health. It sits within many areas of healthcare, but specifically in mental health. But we are looking at opportunities to try and recruit staff, and also working where we can with third sector. So I think we've taken it over in the last month or so, but there is a new leadership team being developed, and we are focused on
really doing what we can, but there is opportunity coming here. So we will continue to appraise across all 3 IJBs and the acute sector.
That's great. Thanks very much. That's very useful to hear. So I don't know, has everybody come in who wanted to come in? Jill, I see your hand up.
Thank you, Chair. It's just to give Dr. Humble some assurance around the primary care interface around that as well. Dr. Clement alluded to the primary and community care group that is being established, and we need to just make sure that that links very closely with the work that's going on around urgent and crisis care as well, because actually the whole thing should be seamless across that 24/7 period, and we shouldn't be adding any significant blocks into the pathways or the models that are developed for the individuals who need to contact a service. So just to give assurance that both of those groups are up and running, and there is going to be good GP input to the primary care group, and we will make sure that the 2 groups align so that the 24/7 period should be seamless.
Thanks very much for that, Jill. Councillor Speed, I see your hand. Is that a legacy hand or a?
No, is it okay, Chair, if I just come back in just a final question, if that's okay?
Yep.
Yeah, thanks. Yeah, I'm just very conscious that one of the key themes and commitments around the mental health strategy, kind of nationally and locally, was around ensuring that those with lived experience were able to feed into our plans, and particularly locally. I just wondered if I could have some kind of clarity around how people are able to contribute. I'm aware that this is a live public meeting, and there may well be people who are listening in who wish to share their experiences to help improve our services.
Okay, I think we've got Sally on the call. I don't know, Sally, if you want to take that one. Not to put you on the spot, but
that's okay, Chair. Thank you. No, we'd be very happy to hear from people, and I would liaise with my my colleagues and to see the best way to do that. But we definitely would be able to facilitate capturing stories, because I'm passionate about capturing real life stories, because there's nothing better. These people have real lived experience, and we have to learn from that. So very happy to take that forward.
Okay, so I guess, Sally, I know you and I know how to contact you, but for, I guess, the members of the public who don't, I mean, what's the best kind of point of contact to make that?
Yeah, rather than say something just now, I think it's better to plan this out, think it out, Lois, and just make sure that we are confident in our approach. I think that would be the best thing to do. Are you happy with that approach, Gail? But I'll definitely liaise with you.
Sally.
And
Yes.
Okay, thank you.
We'll take that as an action point then. That's great. Thank you.
Thank you.
Jill, did you want to come in again? I see your hand is still up. No.
Thank you, Chair. Sorry, it was just to give Council Speed assurance around the development of the strategy, and individuals with who've had a lived experience have been involved in that quite heavily, and are represented on a number of meetings as well. But I'll certainly work closely with Sally, and that will form part of our comms and engagement for our local implementation plan going forward for Angus, to ensure that we capture everybody.
Yeah, that would be great. Thank you.
Do we have any other comments or questions? No. So are members happy with, I read the recommendations out at the start. Are we happy with these recommendations? Yes. Okay, thank you very much. So moving on to agenda item 6, this is the finance report 2020-2021. There's a number of recommendations included in the report, and I think I'll just hand over to Sandy now to say a few words to the report and with regard to the recommendations as well. So thanks, Sandy.
Thank you, Chair. Just before I start speaking about this report, if I could just reference back to Graham Martin moving on from the IGB board. Graham was also a member of our audit committee, and so at some point in the probably near future, we'll probably have to seek a replacement for Graham. Just to know that, I should have said that earlier on. So, Chair, thank you. With respect to this financial report, this is a regular report that we bring to the IJB, setting out an update of where we are with a series of recommendations. I'm going to go through it to pick out a few bullet points, mainly because I want to make sure the board are cited on how some points in this financial report link in with other issues, perhaps action points and things like that. So really, it's to make sure people are spotting connections in all the papers that we're seeing at the IJB. So if I start at the beginning, the first thing I'd like to just note is we have a number of recommendations that the chair has outlined. As I talk you through this report quite briefly, I am going to recommend we change recommendation 3, and I'll explain, sorry, 3B, and I'll explain that when I come to just describing our position regarding reserves further on in the paper. In the background of the report, we do note in the second paragraph that we're obviously reporting against a COVID background, and although a lot of this information is based on February information, so getting quite close to our financial year end, in fact that financial year end is obviously finished now, but we haven't finished doing the numbers. But because of the COVID complications in our accounting, we do still expect to see a bit of variation in our year-end reporting. So it always feels slightly odd. We've got a February report, we're at the start of April, we're doing our year-end, but there is still scope for movement because of a lot of the issues associated with the COVID reporting. And the third paragraph again in that background section does note that there will probably be changes in our financial accounts regarding perhaps things like reserves, as we move from doing management accounting report, which is what we routinely report to the IJB, to our financial accounting report, which is what people will see going through the audit committee. So again, at this point in the year, it's always worth just keeping that in mind. A good chunk of the next part of the report should be relatively familiar to people, section 3.1, for example, 3.2. But if I could just highlight section 3.3.2, and that's on page 54. That references where we are with some mental health resources, and I'm flagging that one up because it ties back in with some action points that we've talked about earlier on and elsewhere. Just after that, there's a section 3.4.1, which is about prescribing. The narrative in that section notes that we saw a significant increase in costs and volumes in December across the middle part of that paragraph. Of course, when we wrote this, that was the most recent information we had. We've now got January information in, and the costs did come down quite a bit. So there's quite a lot of volatility sometimes in the month-to-month reporting of prescribing costs, or indeed the month-to-month prescribing, and then obviously in the consequent reporting. So we think that'll hopefully have evened itself out, and by the time we come to do our year-end reporting, that will hopefully have shown effect in terms of our actual outturn at the end of the year. Moving on to page 55, or bullet point 3.6.2, there's a reference to the large hospital set-aside there. And again, that ties back to previous action points and things that board members have seen in previous papers. So it's important to keep that in mind. Further on in the report, there's a section about adult services. A lot of the content that we're seeing in there is familiar to all the members from things that we've said in previous reports to the IJB. But it's worth noting section 4.1.2, because that section talking about the increase in our increase in our home care delivery very much ties in with the next report we're seeing at the IJB. So this picks up the financial impact, and in the next report you'll see how it's reflected and commented on in the demographic report. Moving further on in the report, section 5 talks about the financial impact of COVID. The second paragraph talks about the funding allocations we've had from the Scottish Government, and the Scottish Government are very clear that they're expecting some of the funding that we've received this year will help us offset any COVID costs in the next financial year. The way that will happen is, although we've received this money, it will transfer through our reserves and increase those reserves, but it will create a kind of a COVID reserve to allow us to support costs in the next financial year. And that's something that is not unique to Angus, it's obviously happening throughout Scotland, and the Scottish Government are clearly cited on that. The next point I'd like to just flag up to everybody is regarding Appendix 3. This is the final point I just want to draw everybody's attention to. Appendix 3 describes where we are with our reserves, and there's a couple of points to note in that, kind of slightly linked to what I've already said. The first paragraph notes that our reserves will increase because of COVID funding that will now sit on our reserves to help support costs next year. The third paragraph describes a position regarding Scottish Government funded programmes where, because of the way the Scottish Government are funding certain things in this year, we again, as will all other IJBs in Scotland, see a big increase in our reserves associated with a number of programmes: Primary Care Improvement Plan, Alcohol and Drug Partnership and Mental Health Action Plans. Doesn't change anything about our planning or our plan delivery. It really is a financial transaction that the Scottish Government done that will be then reflected in our financial accounts. So I say it doesn't have any fundamental change in terms of our plans, but it will affect our financial reporting. The last point I'd like to pick up on that page 61 regarding reserves is further down the page. It's a section described as financial planning reserve, and there are 3 bullet points. And this is where I need to reference back to suggesting we change the recommendation 3B I mentioned in the report earlier. I have probably got maybe a bit ahead of myself and thought we were going to be more progressive with things than we actually are. And that's probably because we're still finding the COVID issues are getting in the way of us concluding work. And I've built most of my recommendations around the second and third bullet points, but I think we are probably better to amend the recommendation at the front of the report to reflect the first bullet point here. And that would be to say that the IJB agree to continue to progress options to release these reserves back to partners. Okay, so that would be a suggested change to the recommendation and more reflect that it's still work in progress and an idea that we're still developing. And of course, that's my thoughts there, Chair, just to share with the board. But obviously happy to take any questions on that point I've changed or any other issues in the paper.
Okay, thanks very much for that, Sandy. I think I'd just like to note at this point that Angus IJB will be achieving a financial break-even position for year to end March 2021, and with such a challenging year on so many accounts, Sandy and his team are very much to be congratulated. And I know, Sandy, you always prefer to urge caution in terms of indicating overall position with so many what ifs and many issues that are out with our sole control. But to bring us to year end with a break-even position should very much be commended. So thank you. Do we have questions or comments for Sandy? I don't see any hands. No. So Councillor Miles.
Yes, I would support Sandy's recommendation to change the reserves position at early point. So I would support that.
Okay.
Thank you.
So that was going to be my next question. Are members happy to support these recommendations with the proposed change that Sandy has verbally intimated? Yes. Okay, that's great. Thank you very much. So we move on to agenda item 7, and this is sorry, I'm just scrolling through my papers. And the impact of demographic change, older people's services. So we've got a number of recommendations again to note the content of this report and the impact of current and estimated future demand. And we're also asked to approve consolidation of this information into the strategic financial plan and to support the work being undertaken to try to manage demand and costs. But I'll pass over at this point to, is it Sandy again? Yep. Okay, thanks, Sandy.
Thank you, Chair. Yeah, so this is provided as a report to make sure the board is cited on one of the biggest issues that we continue to face within the partnership, and that is managing the impact of the demographic changes within our population. And of course, one of the recommendations does have an impact on our financial planning. Effectively, it's our resource planning. And that financial plan appears as the next item on the agenda. So again, there's links here. But let me just make a few comments for everybody. We had a similar report for those of you around in December 2019, setting out where we were with demographic pressures then. Ideally, this report itself would have probably appeared in December 20, just as we were developing our financial plans, but we are behind and playing catch up due to COVID issues. But we've managed to bring this together with a lot of work from various people in the finance departments and the support departments, performance departments, and the likes of Vivian Davidson's teams and others. So this report is designed to kind of set out, as I say, the impact on resources of the demographic shifts. Paragraph 2, or sorry, the background section 2 of the report does note, though, that during 2021, the last year, kind of aside from the demographic changes, because of the way we've been delivering services, we have seen a step change in our delivery of home care and a step reduction in our delivery of services through care homes. And this is picked up in the next paper, but there has been a significant shift. Now, that is a significant issue that we have to tackle. I say the next paper covers it. But the demographics that underlie our population, they continue to be there. That growth will continue. So we are still having to plan for demographic change, despite that step change that we've seen in home care growth and shift away from care home services in the last year. So that's worth keeping in mind. Section 3.1 then goes to describe how the population itself is changing. And I was actually just looking back to the report from December 2019. What you can see in table 1 here at the bottom of page 65 is that we are still seeing big growth forecast in the over 75s and the over 85 population. Of course, generally, the older the population, the more of our care we will need to provide for that client group, that service user group. But I think it's just worth noting that the 65 to 74 age group is scheduled in this report here to actually gradually drop off a wee bit. And even as recently as 2019, we were reporting that change hadn't started to come down off the top. It was about kind of flatlining, but now that's starting to come down. That might just be a sign of the age groups gradually shifting through. But of course, for us, the age groups of 75 plus and 85 plus in particular are still going up. Table 2 further down shows how we expect our principles or our strategic planning assumptions regarding the way we address and manage the changes in demographics. It shows how they affect the delivery of home care or personal care. And we generally, as it's described below that table, we are generally through the Angus Care model expecting most of our growth in care to happen through personal care, and that our delivery of residential care and hospital care will not grow, remain static or potentially reduce. So it's worth kind of just understanding fully why we've captured the information in that way. As I say, it's a reflection of a strategic plan generally. Section 3.2 then describes the services that we need around that community infrastructure to deal with the increased pressure coming through from demographics, and hopefully a lot of people would recognise that care is everything that you'd expect to sit around a kind of a community infrastructure to respond to the increases in demand. And what that then does is, towards the end of that section at the top of page 69, it kind of translates that kind of the need to respond to the change in demographics. It translates into need and then translates it into a financial resource. And this financial resource then appears in our financial planning papers. And that's one of the things that we're looking for approval of, that kind of resource envelope, so that we can then build it into the next paper. That's all the comments, Chair, that I would like to make, but there's an important section towards the end. Section 6 describes the work we're looking at in terms of demand management and mitigation. And there's a full appendix that describes some of that work, and George might just want to comment on that. Thank you.
Okay, thanks for that. George, did you want to come in just now?
Yes, we were, Sandy and I kind of agreed to do a joint job on it, Chair, but Sandy's done such a good summary, it hasn't left me much to cover, which is fine by me. So I think probably what's happened, there's been previous reports about projected growth demand. I think it's coming a bit more quickly than we anticipated, and a bit more heavily, if you like, a bit more fully than we had anticipated. And I think quite a lot of that's been prompted by COVID, and changes have been accelerated by COVID that we might have expected to happen further down the line. Fortunately, it's consistent with our strategic plan to try and maintain more people in the community and use less hospital bed provision and less care home provision. So the the long-term outcome is what we want to try and achieve. But I think the report captures quite well all the pressures that go with this direction of travel. Obviously, I've got a big interest in most of those services that are in that section 3.2 around the impact for other services of maintaining people in the community. So enablement and response, increased potential provision of daycare, an impact on care management. We know that from previous reports that anything that happens around increased provision of personal care at home has a direct knock-on effect for care management, likewise for district nursing. So quite a lot of anticipated impact in there, and we're working some of that through, and there are anticipated costs around that. Now, the appendix itself, I did think about just providing the whole of the demand management action plan as an appendix. Decided not to do that in the end because it is very detailed, probably too detailed for the board, and also it's bits of it move at different times and at different paces, like all action plans. It's a movable feast and a work in progress. So I just tried to summarise it there, the key areas that we're working on, and the kind of percentage completions in those key areas. I was quite pleasantly surprised when I did the most recent update on this, that I did feel before I did it that we had lost a lot of ground because everything had been a bit suspended because of COVID. But actually we've managed to make better progress against most of the things than I thought we had, probably with the exception of case reviews, which we haven't really managed to get started to work on that at all. So it's there. I'm quite happy to take any questions on them. One thing I would really draw attention to, I think, is technology-enabled care. Sally's here and leads on that. We've done a lot of work in that, and we think that's really important for the future. Okay.
Okay, thanks very much to both Sandy and George. Just to say personally, I found this a very useful paper, really good to see, you know, sort of encouraging that longer term view and really sort of showing the impact of the Angus care model as well. So thank you for this paper. So I've got a number of hands up. Councillor Bell.
Thank you, and thanks very much for the paper. I found it very helpful too. And the thing that jumped out for me was around more detail on what are we doing at earlier and earlier stages, you know, in various life stages. For example, you know, the free school meals might be one of them, but it's about the health promotion and health improvement messages much earlier in the whole process, if you like, to impact demand management, because it's great that people are living longer, but we want more people to live longer free of complex health conditions, which would ultimately have a beneficial impact, not just on their health, but on our capacity. So I know that ties into the strategic plan, and I know it is in there, but I think that it's such a good argument to make that investment early in the whole health system that allows people to live longer, healthier lives. And is there anything that you can, you know, can just verbally that gives us maybe additional, might be spent in that way? And I appreciate it's a much longer term strategy and it's harder to evaluate, but I do think it is a good argument to make that investment earlier.
Okay, we lost you a little bit there, Councillor Bell, but I'm not sure if I don't know who wants to take that. George, did you want to come in on that, or Gail?
Yeah, I can do. I suspect Alison might want to add to it.
Oh, sorry, your hand's up as well. I didn't see that.
It's a good point, Julie. I think that's probably the one area of our strategic plan that has been the most adversely affected by COVID, and we're behind with it. Now, it's interesting that paper focuses on older people's services, and that's deliberate because it's our biggest area of growth. But there are lots of other areas where we want to strengthen preventative work, not just with older people's services. And it would be fair to say that they're the older people service group, they are consumers of the higher end services for the most part. They have the same health needs as everybody else, but they're exaggerated by frailty and advancing years. So it depends on how you define early intervention and prevention. But for me, many of the folk in older people services feel as if they're beyond that level of intervention, and it's a much higher tariff of intervention. But that said, across the board, we need to refocus as part of our recovery plan, I think, on the preventative and early intervention work. And that's been a bit lacking. And I think we would want to pick that up under the strategic planning group's activities again. So the strategic planning group, we suspended it for a number of months because of COVID. We've had 2 fairly short meetings to get some momentum going again. I chair that group, and we've committed to going back to full meetings now that we're getting a bit more space. So on the list of things to do is for us to revisit early intervention and prevention. I think obviously third sector have got an absolutely crucial role in that, and we would look to take that forward. So a bit suspended, but we recognise we need to get that back on track. I think Alison will want to add probably. So.
Thanks, George. Julie said a lot of what I was planning to say. I think that COVID has meant for many people that they've not been out and about, they're losing their muscle power, you know, concerns of social isolation and the impact that has on your overall health. So I do think that we have a bit of work to do. George is describing that we're moving early to keep frail people in the community earlier than our strategic plan. I do think there is a real risk that we might have had some regression in some of our enablement response, and things have maybe taken a backward step. And I can see that in some of the prescribing that's going on. We're actually increasing our prescribing in the last 3 months of 2020 compared to the previous year in some chronic pain, mental health, diabetes prescribing, whereas overall the picture had been an improvement. These are things that are in our strategic plan. So I do think there is work to do to reverse that now that we're able to get back to a bit more of normality and to actually see people, encourage people to get exercising and be less isolated. That would be incredibly important. I would highlight independent living, Angus, and the website, also particularly about the life curve that's there, and we've talked about this before, preventing people at all stages of that life curve. So not just the high tariff, but the bits in between that and the early years that Julie has mentioned. We need to work all aspects, trying to enable people to be healthier for longer. And instead of starting to get your first long-term condition in your 40s and 50s, try and keep people healthy in their 60s and 70s. And just by the time you get to your 80s and 90s, and frail, the time that you're spending frail is a lot less, and that's not to take away from any of the care that's needed. That's very, very, very important. I don't think that any of this increase in demand is at all anything we can do anything about, but I do think what we need to work at now is preventing that demand being needed in the first place. I would also highlight the absolutely key and valuable role of our AHPs in this, and that is about the people who are maybe starting to not be able to do things independently. Maybe I think one of the first things on the life curve, if you look at the website, is the not able to cut your toenails yourself. I know when are we acting at that to really get in there and empower people when they maybe just need one carer to really work on their balance, their mobility, their independence, use of technology. And I would highlight that our physios and our OTs and speech and language therapists, dietitians, and I think there's about 20 odd AHPs, absolutely key in this. And I would like to see them have a leadership role around some of the sort of early interventions that we could have. And they're not mentioned there in the overall financial impact. Community nursing is, but AHPs do have a role, and I would like to see that through the strategic planning group, how we describe that and keep that momentum on the prevention wherever possible. Thank you.
Have we lost our chair?
I think we have. I don't see her.
I think she probably drops out. I can't see her.
No,
Who's our vice
She's coming
chair?
back into the meeting just now.
All
She
right.
seemed to
Here
have
we
lost
go.
connection, I
Yeah.
think.
Right, okay.
Hi, Imogen, we lost you for a minute.
Sorry, I don't know what happened. My internet just disappeared. I'm back.
Can I add to what Alison was saying? I think that's really helpful. And you know, whilst our very elderly frail group might not be early intervention, there is a big prevention element. Alison's right in that, in preventing for as long as we can, the onset of the aging process, or ensuring good aging would be a better way to put that. And we are looking to strengthen enablement service to that end. But I think it's worth mentioning care homes. I chair the care home operational group, and we've been discussing in that group the decline in residents' functionality recently, and I think that is directly to do with the living environment that has been required during the pandemic. So we know that good aging is characterised by lots of socialisation, lots of physical activity, lots of contact with family and friends and so on. Those things have all been pretty difficult to achieve during the pandemic because of the constraints of social distancing and so on in care homes. And I think as things begin to loosen up, that group is committed to looking at that issue of functional decline with residents and trying to make some inroads into that.
Okay, do we have any more? Sorry, I'm just coming back into it. So did we have more comments or questions? Peter?
Yeah, I was just wondering, based on what George was saying, whether that's going to roll across to the independent care home sector.
Yeah, when I talk about the care homes, I include everybody in that, Peter. So
Okay.
In-house, independent, third sector, whatever the provider is. Yeah.
Good.
And Sandy?
Yeah, thank you. I just wanted to come back on a couple of points. The first one was Alison mentioned that we didn't have an AHP kind of line in that report, and you're right, Alison, we didn't. One of the reasons we didn't put that in is we did look at the existing resources in those services, and there is still quite a bit of resource in those budgets that can still get deployed next year. So we thought there was flexibility to increase the service delivery in that. So we did take that into account, and I've written down another note to myself, make sure when we're doing it in another year's time, we reassess where we are with the HPs. You're completely right, that would be part of that, but we did, just so you're reassured, we did make an assessment of the existing resource, and there definitely is scope to develop that a wee bit beyond where we are. But one thing I'd really quite like to draw everybody's attention to is going back to the point Councillor Bell made regarding preventative measures. If you could please maybe have a look at page 81 of your report papers, and it's section 8.4 of the next report. Hopefully everybody has electronic copies and they can kind of get to that relatively quickly. And that paragraph confirms, I think, what many of you are seeing. It says, this is about financial plan, not about the last paper or the one we're on right now. It does confirm that the financial plan, that's the next item on the agenda, does not set out plans for a stepped investment in preventative investment, stepped increase in preventative investment. We'll then go on to describe where we are, and I have, obviously in a fit of optimism, I have said there is a possibility of a coming together of healthy financial position, supportive investment from the Scottish Government, and potentially a willingness to look at some areas of residual high cost that we have in the partnership that could eventually allow us to release resources to do that preventative investment that Councillor Bell was asking about, and I think we all generally agree was a helpful thing. So again, that's in the next paper, but I just wanted to kind of link the question that was asked just now with how it then appears in the financial plan. Thank you.
I think that's a helpful link to make. Thanks, Sandy. Councillor Speed.
Yeah, thanks, Chair. Yeah, obviously a key message throughout the report is around the increased care at home. And what maybe I would have liked to have seen would be a bit of a reference with regards to our partnership working with housing colleagues, because obviously an increased care at home, people's homes need to be fully equipped and adapted often to be able to cope with changing health needs, to ensure that there's kind of, carers and support staff and people coming into the home have a safe working environment. And just in terms of kind of that sustainability at home, especially with a further increase because of the pandemic. So I just wondered if that's something that can perhaps be brought to a future report with regards to this, a future update, because I do have concerns around whether people's homes are going to be sustainable enough. The medical housing lists are have a high demand. There's lengthy wait times, and the knock-on effect is that people often escalate further up the health and social care tariff and need greater support because of the pressures in the home environment.
Thanks for that, Councillor Speed. I think that's a really well-made point, and I don't know if anyone's able to give us some assurance in terms of working collaboratively with the housing departments, and certainly I would echo Councillor Speed's request for a future report on that particular issue.
Yeah, I can, Chair, if that would be helpful. Yeah, we have pretty robust joint operational and strategic arrangements with housing. I think though it's a fair point, we haven't really covered that in the report, and we should do that in future versions.
Great, thank you. Andrew?
Hi, thanks, Chair. I kind of already raised this in the SPG, but I think I'll raise it again. I just want assurance that due consideration has been taken into account of the fact that COVID may have increased the demand for care at home artificially. It was mentioned that this was a sudden change, kind of bucking the trend. And I just want to make sure that we're not just like kind of putting all our eggs in one basket, as it were, and there may be a reversal back to care home uptake again when the pandemic decreases. Now, I had certain reassurances about that before, but I'd just like to re-raise that that issue again, if I can get a response on that, please.
George?
Okay, I'll come back in again. Yeah, we've gone in care at home from 10,300 hours at the start of the pandemic per week to we're just under 12,500 this week in planned hours. So it's a big increase. I think, and this is not scientific, it's our best guess that had it been a temporary measure, it would have peaked earlier. So we've seen a year of just continuous growth in demand. I thought when we got to about 11.5, it would probably peak at that and level off, but demand is increasing again. So I don't think we're going to revert back to anywhere like we were before. Now, as you'll see in the papers today, we think part of the solution is to move resource and capacity from the residential sector into the care at home sector, and I think that's necessary. But we're being very prudent and cautious about the amount of resource we would move. We're only talking 40 to 50 beds out of 150 vacant beds in the care home sector just now. And that's because, Andrew's right, we don't know exactly what the kind of bounce back factor might be. So we're being pretty cautious about it, but I don't think it'll revert to what it was before, Andrew. I think we're past that point in the loop, if you like. Yeah.
Okay, thank you. Sandy, did you want to come in again?
Yeah, thanks, Chair. I'd just like to go back to Councillor Speed's reference to housing and kind of less things like equipment or adaptations in homes. That is a good point. I feel slightly remiss of us not to have included that in this paper, but I'd like to think that we had thought about it and had a good answer, Councillor Spear, as to why we didn't include it. But off the top of my head, I can't imagine, I can't think what that would be. So as soon as you say it out loud, it's a logical thing to go into the report. And what I would suggest is that we'll reflect on that, we'll look at the background resources that are in place already, and perhaps in an upcoming finance paper we can maybe make some comment on that point that you raised.
Yeah, it's okay, Chair, just to respond to that. Yeah, thanks, Sandy. No, I'd really welcome that. I mean, I'm aware that there is partnership work goes on between ourselves and housing, but because of the shift and the kind of quite dramatic increase of care being provided at home throughout the pandemic, it would be good just to ensure that our information is being shared, and housing are able to also input as to how they're, what differences they're noticing in terms of their demands on their waiting list. And like I say, I think it's going to be really important that we ensure that people are living in the right home environments.
Okay, thanks for that. And have we got any other questions or comments? Dr. Clement? No, legacy hand. That's okay. So any other questions or comments? No. So are we happy to accept the recommendations that are laid out at the start of the paper? Yes, that's great. Thanks very much, everybody. So we'll move on to the next paper, which I think is Sandy again. This is the Angus IGB Strategic Financial Plan 2021-22 to 2023-24. And we've got a number of recommendations here, but I'll let Sandy speak to the paper and go through some of the recommendations with us. So thanks, Sandy.
Yeah, thanks, Chair. And I kind of almost feel I should apologise. This paper is getting quite long. We've done a number of financial planning updates, and I think this turns out to be the longest. It's not my intention to write up long papers for everybody, but there are obviously a lot of things going on at the moment, and that reflects the length of the paper. We do try and make the paper still relatively accessible. And I would always encourage board members, if they kind of just want to have a chat about the content of a paper such as this, always to give us a call, because I appreciate it's long. As I say, it's not designed to be complex, but it certainly has a lot of content in it. In terms of the paper, it's a follow-up paper to one that you saw in December, which is a provisional financial planning paper. Since then, we've obviously, where we had uncertainty, we've now got a bit of certainty. A number of assumptions have been found up, so the paper absolutely moves us on a wee bit, we have kind of made references to things like COVID and things like that in here, and we're treating the kind of one-off cost of COVID as one-offs and looking a bit at those, but also at the underlying picture. In terms of picking out some points from the paper, I think it's important, like I said in the last one and the last couple of papers, to just draw some points out, to link them together. And I think if I could just start with the recommendations, not dissimilar to item 6 on the agenda. I think I probably do need to amend one of the recommendations, and in this case it's the first recommendation. I think I've just probably got a wee bit ahead of myself because some of the numbers have moved since we put some of these papers together, and I'd like to defer recommendation 1 until I've had a chance to revisit the numbers based on some of the final Scottish Government allocations rather than our discussions with Angus Council. Coming through the paper, the background section on page 73, at the top of page 73, has a whole series of bullet points. These remain the constituent building blocks of our financial plan. Hopefully they feel logical and familiar to board members. Where are we right now? What funding assumptions, budget settlements do we have? Cost pressures, inflation pressures? What are we doing in terms of planned interventions and changes? How are we doing with things like prescribing and whatever? So that hopefully, as I said, does feel familiar to people. If I could then move on to section 4.1, which is on page 74. This reflects budget papers that you've seen already, but it also reflects continuing updates of that information. And there's a section talking about the funding that comes through the local authority having a late adjustment in it. And that's the reason why I want to defer item 1 on the agenda, because we haven't got quite all the details of all that sorted out yet. So it was probably premature of me to put that recommendation in. But we're still working on that. 4.2 talks about our budget settlement with NHS Tayside. We have referred to that in previous IJB papers. We have still got a number of outstanding issues, and obviously we can't agree them unilaterally. We have to agree them with NHS Tayside and make sure we have a consistent reflection in our financial plans. That's a series of outstanding issues there that we're still in dialogue with NHS Tayside about. Moving further on in the paper to page 76 and bullet point 5.3, let you just get there. That's a series of descriptions about demographic pressures. You'll recognise that heading obviously immediately. The second bullet point refers back to the paper we've just seen, so that kind of links those two. And the third paragraph again describes that's kind of step change. Again, was referenced in the last paper, where we feel we need to allow for the fact that we have seen this step change in home care use that Andrew and George were talking about earlier on. Further down the paper, section 5.4 on page 77 lists a number of legal obligations, national priorities and things like that. Much of this emanates out of kind of Scottish Government priorities. You hopefully would recognise a number of the things there, so they're all kind of built in. A lot of them come associated with an associated funding stream. Some will come to the IGB, some have been to the IGB in the past. The first bullet point there, just again to link things, is regarding the Carers Act. We also saw a paper that came to the IGB in February. We know we're coming back to that in June, so that's where it appears in our financial plan. But again, it just helps to hopefully link different parts of the paper together. At the bottom of page 77, we talked about planned interventions. These are the changes that we're making that help support things like the demographic pressures. Many of the items in here will be familiar to board members. 6.2.1 for a good 10 points there, down to 6.211 are all things that you will be familiar with. You've seen them before. They maybe got a slight timing adjustment reflecting some delays from COVID. But they're kind of there or thereabouts in terms of things that we've seen before. Further down that section on page 79, particularly section 6.5, this refers to this shift in our delivery of care home, our commissioning of care homes and home care, so that the way we configure our services for over 65s. It's been mentioned already in the meeting. We have seen this stepped increase in home care and a stepped decrease in care home delivery. The paragraphs here describe some of the numbers, and George has just alluded to that in a few minutes ago. The resources associated with this can obviously come across in numbers of beds or hours, but we also, in this paper, because it's a financial planning paper, also translate that into the monetary resource. And you can see the scale of some of these resources that we're describing. Hopefully there's detail there that would allow people to kind of understand what we're proposing. It does allow us to firm up on the deliveries, the delivery kind of configuration that we have right now, and to kind of reflect the fact that's kind of becoming embedded. And it basically allows us to keep our financial planning synchronized with where we are in terms of our kind of general responses to your service and user demands. So as I say, hopefully there's enough detail in the paper there to kind of describe that proposal to everybody. Coming further down the paper, section 8.4 on page 81, that's the one I've just mentioned to you. Well, when we were talking about preventative work, and George, I think it is the description of, responses to questions of the last paper, talked about taking that through the SPG, and that's what that paper, that's what this paragraph suggests here, as a precursor to looking at preventative investment. Further on the paper, we mention risks, we mention the impact of COVID and how we responded to that, and they're all important things for everybody to keep in mind. And then section 12.1 summarises where we are. There's a table there showing that we do have overspends forecast in the first and second year of the plan, but we can afford to cover those through the use of planned reserves. That's obviously not ideal because planned reserves are only one-offs, and obviously as an IGB as a whole, we need to address the underlying position, and that's covered in some of the next. Chair, hopefully that's just given a wee bit of context and allows again things to draw together and link things up. I'm happy to take questions, of course.
Okay, thanks very much for that, Sandy. It is a very comprehensive paper, and there's a lot of information there, but I think you going through it like that is very helpful. I've got questions and comments for Sandy. No, not seeing any. Okay, so if we move to the recommendations in that paper, so there are a number of recommendations, and Sandy has suggested that we just remove number 1, isn't that correct, Sandy? So to go with the rest of the recommendations?
Yeah, we're essentially just going to defer it until I need to kind of catch up with some of the other information that's come in.
Okay, so are we happy with the rest of the recommendations, which are about providing regular updates regarding the progress of the plan, recognising the risks associated with the overall strategic plan, financial plan, recognising the organisational burden of progressing new developments, and support the allocation of 10% of new funding streams to those burdens where allowable, note the forecast financial shortfalls over the duration of the plan, and approve this new strategic financial plan for 2021-22 to 2023-24. Everybody happy with that? Okay, thanks very much. So we're moving on now to agenda item number 9, which is, sorry, just going to find it here, is the update on Angus' response to proposals from the Ministerial Strategic Group. And for this paper, it's recommended that we note the progress made on delivering the action plan, and then agree that the IJB Audit Committee will assume responsibility for reviewing the outstanding MSG actions. George, is this you speaking to this paper?
Yes. And Vivian Davidson's here as well and has done a lot of work on this.
Hi, Vivian.
Yeah, just to remind people, MSG stands for Ministerial Strategic Group, and that was the review initiated by the Scottish Government back in 2019. It's all been a bit stalled like everything else by COVID, but quite a lot of the actions in the original improvement plan that we developed locally have been completed, and the ones that are still in the report are the ones that require further work to conclude them. The idea here is that these will be rolled into the review of the integration scheme. Vivian has been seconded part-time into that role to carry out the review across Tayside, so she is our expert on it. And the other idea is we think now it's probably reached a stage where this progress on it can be reviewed by the Audit Committee, which reports into the IJB anyway, and it would be included in their reports if the IJB is amenable to that idea. But I'll bring in Vivian and see if there's anything she wishes to add. Vivian?
Thanks, George. I think the one key outstanding action that we need to take forward locally is around reviewing our strategic commissioning process. We have allocated resource to do that. It was held up last year. It was a piece of work I should have done last year, but we've now allocated resource to do that, and it will be progressed over the next few months. And we should see a range of improvements in the effectiveness of our strategic planning arrangements in preparation for developing the new strategic plan. The other actions most certainly fall into the scope of the review of the 3 integration schemes across Tayside, including certainly in Angus, and we're making the recommendation that this would happen in Dundee and Perth and Kinross as well, which is to develop a memorandum of understanding around the support arrangements, which have changed from time to time from both the council and NHS. So we want much greater clarity over what they are and what resources will be available to support the functioning of the IJB and the partnership. I think we've got to a very good position. There were 25 recommendations from the Ministerial Strategic Group. From our self-assessment, we identified 57 separate actions that we could take. And I think we've got to a very good position now. it may be at some point in the future that the Ministerial Strategic Group will ask for a further self-assessment in relation to the proposals, but that certainly has not been put forward yet.
Okay, thanks very much. And I would agree with you. Actually, we have got to a good position. And one of my questions was, or well, my main question was, is there likely to be a further request for self-assessment? So you've answered that at the end, Vivian. Thank you. Does anybody have questions? I've got Councillor Bell.
Actually, I think Andrew was in front of me. Mine was more of a comment.
Okay.
Okay, Andrew.
Thank you, Chair. Thank you, Councillor Bell. It was just that I would like to commend Vivian on her work with the 3 IJBs and in getting this list down, which it's just down to a handful of points. When it first started, it seemed like an insurmountable problem. But I would say that it's just the same old. It's just the same old issues that we're left with at the end, isn't it? I mean, it's. Can I get any kind of indication from Vivian how confident we are that we'll finally kill off these last few items that seem to be the old large hospital set aside, working with partnerships, those kind of problems we've always had? Are they ever going to go away? It's my simple question.
I think there will always be challenges for Sandy in agreeing resources or requisitioning resources from both Angus Council and NHS Tayside. What I am hoping to do with my project team partners is to provide greater clarity in the integration scheme about how some of these things might be calculated. Of course, I'll need the support of all the chief finance officers and the finance officers of the councils and NHS Tayside to do that. But we can look to other parts of Scotland to see how they've resolved some of these issues and draw on that. I am hopeful that we will be in a better position in relation to all of these actions.
So thank you.
I think
Emma Jane
frozen. Is Emma Jane frozen?
I think so. I think so. We need to wait for her to come back in.
Lois, can you take over the chair, please? Emma Jane's frozen. She sent me a message.
Okay, I can do. I think Councillor Bell.
Okay, thank you. Actually, following on from what Andrew said, I just wanted to give a bit of reassurance that all these issues come up on a regular basis at the Audit Committee and they are discussed. And we did discuss today at some length how we could support some of those conversations. So that offer is there to Sandy if required, because like you are concerned that things are hanging around for quite a long time, and it would be great to get closure on those few remaining points. But I just wanted to thank Vivian for all her work on that, and to acknowledge the progress that has been made. It's not insignificant, but those are the tricky ones that are left, I think, that aren't necessarily in our gift to close off. So if there's anything Chair of the Audit can do to help, happy to oblige.
Thanks, Julie. Sandy, I don't know if you want to come back to that offer.
Yeah, I will. Thanks, Chair. Yeah. Thanks, Councillor Speed. Yeah, there's just been mentioned there from Councillor Bell, and I think probably others will know that we have seen a number of these actions on a number of governance agendas for quite a number of years, including things like our annual governance statement, which is part of our annual accounts, I suppose I do remain hopeful that in various different ways, and perhaps in evolving ways, and ways that we haven't tried before, we will be able to address some of these points, and maybe one or two other people with their hands up might be able to respond to that. But we do keep an eye on them through the audit committee, and obviously we're grateful for your board members and audit committee members' support in trying to solve these, help us look at avenues for solutions.
Okay, thanks, Sandy. Dr. Henry?
I think just to speak about the large hospital set aside, this is something that a group of us went into with great enthusiasm, and I think it is very complex. I don't know if any other region in Scotland really has managed to get a hold on it. It's something that's been there throughout the inception of IJBs and even the CHIPs before. I think it's not an excuse, but we did get sideswiped a bit doing this by COVID. I think the people who were around the table were ones often we got drawn into some of the operational bits of COVID. But we have a meeting set up, and I think in April or May, to look at this again. I think our attempts to look at large hospital set aside have failed because we've made it too binary between a bed, having a hospital bed or not, and actually some of the whole system work in Tayside might inform how we can better capture what's happening. So I think there is willing, and I am optimistic that we will make progress on it. But I think we do look back and we think, gosh, what have we done on this for the last year? But I think that there is some reference that COVID has almost snipped out March 20 to March 21. But we are, and I think there's some learning as well that we can take forward of some of the stuff that we did at pace through COVID. How can we do that again and capture that and use it to evidence in the large hospital set aside?
You're on mute, Councillor Bell.
Sorry, yeah, that's me off. Thanks, Elaine. Gillian, did you want to come in?
Thank you, Councillor Speed. Yeah, it was just similar to Elaine. I think when people hear the term large hospital set aside, they always think about it from a financial perspective. So the group that we're looking at, well, the meeting that Elaine was referring to is around whole system pathways of work. Joining up with Dundee and looking at how we can involve Perth as well, because a lot of those pathways have to be Tayside wide. So just to give Andrew some assurance as well that the things are progressing. We were due to bring a report back to this IJB, but as Elaine's rightly said, the second wave of COVID kind of took us not by surprise, but we were a bit more involved than what we had initially anticipated. So we are anticipating bringing a high-level work plan back to the June meeting. In relation to areas where it has worked, we have got some or have heard of some examples, so we're trying to track that down so that we can see what has worked and what's been done in other partnership areas. So hopefully we'll get our hands on them soon as well.
Okay, thanks, Gillian. Vivian, did you want to come back again? Your hand's still up.
Yes, just very briefly to say that currently the integration scheme does say how large hospital set aside will be calculated in sections 8.14, and it does talk about a monetary value being attached to that. So it has never, in the way it's described in section 8.14 of the integration scheme, it's never been applied. And that is one of the challenges we have in taking this forward.
Okay, thanks, Vivian. Andrew, your hand's still up. Do you want to come back in again in response to some of the comments that have been made?
No, that's just been me being sluggish. Sorry, it's a legacy hand.
Okay.
I'll take it down. Right. What's up again?
Oh no, it's back up again. That's okay.
Right, it's down now. I'll just leave it there. Thank you.
Okay, I don't think there's any other fresh hands gone up. Gillian?
Thanks, Councillor Speed. It was just to give assurance that parallel to the work that we're doing around the whole system pathway, that there is work around the financial element of that as well. So We're looking at the clinical pathways and working very closely with colleagues in finance, Sandy included in that, around that financial framework to support the shift. But what we don't want to do is have finance driving it. This is very much about clinical pathways and models of care, rather than it being financially driven. So the work from a finance perspective is happening parallel to that work, and we're working very closely together. And Alison's involved in that as well, so is Dr. Henry.
Thanks, Gillian. Vivian, your hand's still up. Did you want to come back again, or is... No? Okay.
Hello, sorry, I'm back. I've no idea what's wrong with my internet. It keeps disappearing. So Lois, if you don't mind, just if I happen to drop out again, if you can just stand in, but thank you very much. No idea what's going on with Angus internet today. So that's not one for us anyway.
No problem. Imogen, we were really just finishing off the comments and questions. So there is no other hands up. So do you want to, I'll let you just move the recommendations.
So is this, are we still on number 9? Yeah.
Yeah.
Okay, so are we happy with the recommendations in that paper? Okay, thank you everyone. Thank you, Lois. So moving on to agenda item 10, and this is the Integration Joint Board's risk management strategy. So we're being asked to approve the IJB's risk management strategy, to request the interim chief officer to progress development of a local risk appetite for the Angus IJB and bring back a final report on this, to approve the change in template for IJB reports to include a risk section for all relevant reports, to note that risk training for IJB management and board will be developed and delivered, that an annual risk management report is submitted to the audit committee and the next report is due in June, and that we are to support the continuation of reporting risk management via the audit committee. So I'm not sure who's speaking to this. Is this you, Gail? I'll hand over to you.
I'll certainly start off, Imogen. Yes, this has been a significant piece of work, actually. It's been immensely challenging getting the strategy to this stage, particularly because of COVID, and trying to get the commitment of all the partners at the same time, when you've got people covering for other folk and leave, etc. So I'm delighted that we can now confirm that we have the strategy in front of you. I don't propose to go through all of the strategy. However, I would commend it to you all to read. I want to draw attention to particularly page 96 and 2.5, and that's the risk appetite, which you alluded to there. Tony Gaskin attended this morning's audit committee, and he also spoke about risk appetite. And risk appetite is actually a real integral part of the risk management plan. So it's really important that we do this. The intention is that we would have a separate development event, probably with audit committee members and IJB members. However, the suggestion this morning from Tony was we might want to consider a Tayside 3 health and social care partnership session and event. And I've already contacted my 2 colleagues to see if there's a possibility of doing that. I don't want to draw attention to anything else because I think it's quite explanatory in the report of what we're doing and what our leadership accountability is. And I think it's I would commend the report to you. I think it's been a much needed refresh and update.
Okay, thanks.
If any questions.
Thank you, and I really welcome this Tayside approach with all of the IJBs working collaboratively to produce the strategy. I think it's very good to see. Have we got questions or comments? Peter?
Yeah, thank you, Chair. Yeah, as Gail said, we've been talking about this in the audit committee for some time on and off, and particularly this morning about risk appetite. As far as I'm concerned, this report is very, very timely and very welcome, and the sooner we can deliver it, the better. However, there's a couple of bits I'm not sure about. When I got to recommendation 4, it talked about training to be developed. And my experience in industry and working with local government and central government is to be developed is often accompanied by lots and lots of pound notes and often consultants. So I was a bit concerned about that. I then got to page 90, where section 5, it says there are no cost implications. So I thought that's good. And then I got to page 99 at 6.3, the last sentence says that wherever possible, IJBs will ensure that training requirements and costs will be kept to a minimum. How are we going to bound those costs to make sure we don't have a Rolls Royce instead of a Land Rover Defender delivered?
Thank you for that question, Peter. I don't anticipate we would require external training towards this item. I think what we found when we were looking at it across the whole system is different people had different experiences and different understandings of what risk was, where it was, and also how it was managed, Peter. So I think the suggestion was that we develop a training programme for this, for anyone that hasn't had any training in risk. We've got a new number of members and a new number of managers as well that may not have that understanding. Dr. Clement, is Alison still? Yeah, she's still there, manages risk through our Clinical Care and Professional Governance Committee. And we know when we were developing the strategy and the feedback that we were getting regarding risk, that training was seen as an important part of this to embed that culture and actually the understanding and the ability of people to review their own risks in a cohesive and consistent way, Peter. Sometimes that isn't always done. Dr. Alison, yeah, I can see your hand here. Sorry, the sun's shining in the window.
Do you want to come in?
Yes, thanks. Just to highlight as well, we've got new members of staff as part of the Clinical Care Governance Professional team, who one of whom is doing a bit of work on risk in particular, and they are supporting all of the services to get their services risks onto DATEX and to support that. We do have some IT things that are differences between the health side and the council side, which affect how we do things, but the policy is the same, and the care and clinical care and professional governance coordinators are there supporting all the services. The other thing to highlight is the links with realistic medicine. Understanding risk is one of the sort of 6 main principles of the realistic medicine Chief Medical Officer report. And there is some work going on across Tayside to create realistic medicine champions, and risk's a part of that. So I think risk for me is at all levels, understanding it at the conversations to understanding at service level, to understanding your strategic risks and focus your efforts on and managing these risks and your risk appetite. So lots of work ongoing, but we have got developing infrastructure that can support it.
Okay.
Right, thanks for that, and thank you, Dr. Clement. I think that's really helpful. Councillor Bell.
Thank you, Chair. Yeah, I'm really keen to see joint development sessions take place, but I'm guessing that it would be more helpful to have the risk appetite training happen before those conversations take place, so that everyone's on the same page, really. And I'm wondering if we have any ideas about timescale, because I fully appreciate, well, this is an important thing, but I'm also aware that operational service delivery and all the other stuff on everyone's agenda is important too. So just thinking about when all of this might happen and in what phase.
Each of the IGBs in Tayside are taking the risk management strategy to their meetings this week. So assuming approval, we will then go ahead and develop the risk management training, or certainly the risk appetite session in particular. Now, we could probably organise that if that's a priority for our IGB members and the audit committee. We could try and organise that for as soon as, if that was seen as the priority there.
Okay, that's helpful, thanks. And do we feel that that is a priority then? Have we got some agreement around that?
Yeah, I think given that it was something that Tony particularly drew out in our conversation this morning, that it's a helpful pointer. So I'd be happy to go with that. Okay, so Gail, can you take that as an action then in terms of moving that forward?
Yes, I'll do that. I'm unsure if NHS Tayside have undertaken their risk appetite training. They were also proposing to do some. Chair, I don't know if you've been involved in any of that.
Not to my knowledge, no.
No. Okay.
I don't know. We've got Peter Drury's perhaps on. He maybe would know. No.
No. Okay.
I don't think we have.
They're
no.
also going to do a risk appetite session, so just to try and ensure we tied into that. But I'll go ahead and progress that.
Okay, thanks very much. So in terms of the recommendations of the paper, are we happy with those recommendations? Yes. Okay, thank you, everybody. So we move on now to item 11, which is the date of the next meeting, and that will be on Wednesday, the 23rd of June at 2 p.m. And we now move on to an exempt item. So the Angus IGP are asked to consider in terms of paragraph 1 and 3 of part 1 of Schedule 7A to the Local Government Scotland Act 1973 that the public and press should be excluded during consideration of the following item as to avoid the disclosure of exempt information. And are we happy with this? Yep. So can I now ask any press and public that to leave the meeting?
Chair.
You can let me know whenever we're okay to proceed.
Chair, I've actually sent out a separate invitation for the exempt part of the business. So we need to leave this meeting now and rejoin through MS Teams.
Okay, that's fine. So if everybody wants to leave this meeting and then rejoin for this exempt item, Alison?
Yeah, just to highlight that Gail's asked if Ian Logan and Matt Lambert can join, and so they're waiting to get in, but they can't get into the Teams link. So it's just if somebody can help let them in, that would be helpful.
If you could maybe assist with that, that would be great. Well, we'll all leave this one and go in through the other link.
Chair, can someone send me their email addresses in, please? I can't forward if I don't have them. Thanks, Alison.